Welcome everyone to another wonderful episode here, Doctors of Podiatry. This morning, a good friend of mine actually, 2013, presented with a chronic case of plantar fasciitis. We went ahead and performed a platelet-rich plasma injection and healed with no further complications. So today, actually a couple months ago, she presented with a chronic pain to the left ankle, medial and lateral. But because of, I remember that you were going away you went, I think, to Europe, I think it was, or you had the wedding or this or that.
Yeah, the wedding.
So she had a couple of different events and we were looking for the right time to do this. So during the course of the last 2 years, pursuant to what we think and what the patient thinks, this is an overuse, just in general, overuse injuries. On the medial side, we have a very important tendon called the posterior tibial tendon, and it's suffering. We did an MRI, something called tenosynovitis. Teno from the word tendon, and synovitis, inflammation of the synovium, right? The sheath. So every tendon in our bodies, they have a sheath. And for whatever reason, whether it's injury, whether it's trauma, whatever it is, it can get inflamed. So we're going to go ahead and do work on this tendon, the posterior tibial tendon, and then we're going to go ahead. And here we've already, like always, demarcated the area. We have the fibula here. We have 3 very important ligaments. We have the ATF, the CF, which I did not demarcate on purpose because there's no pain in this area, and the PTF, anterior talofibular, posterior talofibular, and then here, as we've seen in some of our previous videos, we have the peroneal tendons. I posted last night a PRP that we did yesterday on a patient who presented with a chronic case of a peroneal tendinitis or a peroneal tendinosis, degeneration or inflammation. So, you know, a question that I get a lot from patients that, like this patient, that we did the plantar fasciitis and did really well. We don't really, a lot of patients that present again to see us for a different clinical presentation, is it going to work the same? And I don't know. It's hard to say. Especially after 6 years, right? I don't know. But we're going to go ahead and perform a microtenotomy of all of the affected areas in conjunction with our PRP. With our PRP. We got 2 cameras today. The most we've had is like 5, and that's okay. Now we got 3, 4, 2 more. We're up to 4. Give me 4, give me 4, give me 4, give me 4, give me 5, give me 5.
Sold.
No. Sold. Okay, so let's go ahead and we're going to start with let's get a nice clear picture here. So we're going to go ahead and so we're going to start with the PTF. If you feel any discomfort, please let me know. You okay up there?
Yep.
Super. Okay. Okay, that's 1. Let's go to this one here. Any discomfort here?
No.
You feel that celery? Do you feel that? So I feel that it's a celery-like. Can you hear it?
Mm-hmm.
Here.
What is a celery?
It's I
have a cyst there. I have a.
Well, you may have a little lipoma, if anything. Right now, what we're doing is we are fenestrating the anterior talofibular ligament. And I know we're in the right spot, because ligaments in general, just so everyone, you guys probably hear this a lot, all of our viewers, especially our YouTube viewers, that a lot of doctors use the word celery, and it really feels like celery. And you actually like cut the celery. Why not? I don't know. What's another vegetable that looks like celery? I don't know.
Bok choy.
Bok choy. That's exactly what I was thinking. I just couldn't come up with a name.
Bok choy.
Like bok choy, right? So now we're gonna go to the peroneals down here, and I can already,
It feels like celery also. I feel like the
right.
Yep.
No, it's not celery. It's bok choy.
Bok choy.
Okay, super. I'll give it one last one here. Bok choy. Okay, so now let's go to the meat. So here we have to be very careful, because here we have arteries. We have the posterior tibial artery, we have the posterior tibial nerve, and we have the posterior tibial vein. So we need to be very, very careful. We don't want to go
I felt that.
a little bit. Okay, so when patients feel it,
I feel it. I feel all that.
okay, so let's put a little bit more.
Yeah.
A little bit more anesthesia. Actually, you know what? Let me do something. Let me see something here. 1 second.
No, that doesn't hurt.
Okay, so what I'm going to do is the following. See?
And that's bok choy too.
Yep. This one may.
No.
No? You see?
I mean, it's not horrible pain. It's just I felt the little pinch.
Okay. I like, everyone, all of our followers know that, we don't edit anything. What you see is what you get. I personally like when the patient interacts and they can hear
Yep.
you talking and saying that hurts, or that, I feel that.
It didn't hurt. It was just, I could feel the pinch.
You can say it.
Yeah.
Okay, so now we're going to go to part 2. We're going to infiltrate the PRP. Platelet-rich plasma, delivering growth factors, proteins, important cells that aid in the regeneration of the damaged tissue, reducing inflammation as well. Chronic cases like these are difficult to treat, right? Anything that's in that chronic, 6 months, this is 2 years. So we're like salmons swimming against the current. Come around, please. If you feel any type of discomfort, pain, let me know, please. Here we go.
I feel nothing.
Me neither, but you may feel this.
Nope.
We slowly infiltrate. We want to make sure that the PRP doesn't just go all over the place, right? So I'm injecting really, really, really slow here. We are the champions.
I feel that a little bit, but it doesn't hurt.
Okay.
I just feel it.
I'm going to stop here because we're going to need more on the other side. Okay. Let's try to. Perfect. Do we have a good visual there, Patty? Just so we can get a better. Any pain?
Nope.
we were gonna go live on this case, but because everyone is working, we decided not to.
Man, it did help. Like it burned a little bit because my foot is turned.
Okay.
I mean, it's not bad. I'm just reporting what I'm feeling.
Okay, that's good. Reporting is good.
That I don't feel at all.
So we're again slowly infiltrating. You guys see it blanching here. That's the PRP. I don't know if you can get a good shot of that, Patty. We'll stop there. And then the grand finale. We're gonna go 1 and 2. Okay, so here we go. We'll go a third one. Right in the middle. We're done. PRP, platelet-rich plasma. The power of PRP being able to harness the natural abilities and capabilities of using what we have to heal our own problems. A very, very, very interesting article just came out yesterday, and I will try to post it for everyone. How more people are opting out of surgery. A lot of people are opting out because recent studies, a lot of them have recently came out showing that surgery is not the ultimate answer. And there's a lot of subspecialties that might not be very happy with these studies that are coming out, right? So, we've been doing now regenerative medicine for about 12 years, and I've seen, even here at what we do, I've seen the amount of surgery that I used to do also go down because we're able to, solve, I don't like the word cure, but minimize any long-term complications of clinical presentations as such. We were talking also this morning that I don't remember the last time I did a certain procedure to one of our other doctors because we don't need to anymore, because we have such a great track record when it comes to regen medicine, whether it's using PRP stem cells, or any of these real adipose-derived stem cells. And the same thing goes for, total ankle replacements. Just like there are knee replacements, in the world of what we do, there are total ankle replacements. And there's a time and a place, but that's something that we leave as last resort. So, just wanted to share that with you guys, and I'll definitely try to share that article with you guys as well. Like always, www.jawspodiatry.com, Instagram Dr. Tojam, our Facebook fan page Jaws Podiatry, and our YouTube channel Jaws Healthcare. How did it go? We don't have to point over there.
Great. It was great. It was painless. It didn't bother me.
By the way, it was painless because the patient was numb. I want to make that clarification.
Right. I was numb, but it was nothing.
Okay, we infiltrated about 7 cc's of the combination of PRP and PPP. So we had the platelet-rich plasma and the platelet-poor plasma. It's not so poor after all. So we needed a little bit more volume. So we were able to use that as well to maximize improvement. And now, you know, this is the 90-10, right? The 10% is what we did today. The 90% starts now, right? If you want to move a little bit to the side so I can show everyone what they, okay, so this is the 90% right here, This is it. This is the El Grand combo right here, right? We got the boot, we got the Rolls Royce. This is the 90%. And then of course the patient being compliant also falls into that 90%, and then we'll eventually do physical therapy. So I hope everyone has enjoyed this video. I'll definitely post it. Have a wonderful day.